Good afternoon, everyone. Hopefully, this will be our last regular briefing. So let me begin, as I once did, by thanking you for joining us for day 721 of the pandemic. It's hard to believe that just 2 years ago, COVID landed on our shores. Since those days, I have signed 47 out of the 48 extensions of the public health emergency. And I'm happy to announce that, given no curveballs, I will be signing a letter repealing that state of emergency with effect from 12:01 a.m. on Monday, March the 14th. I know many times I've spoken about my thanks and my gratitude for the frontline healthcare workers over the last 2 years. It has been an incredible display of dedication and resilience. Today I want to take a moment, though, just to say a big thank you to the many dedicated individuals in the Department of Health and Community Services, including obviously Dr. Fitzgerald and the public health team. I have, probably for longer and better than anyone else, witnessed firsthand the dedication and unwavering commitment they have had to the people of this province since the onset of the pandemic. There are an awful lot of people, though, behind the scenes that you don't see, but have been here since day one. Despite the long hours, and it has been long hours, days, weekdays and weekends, our core public health team is still the same as it was on day one. And that certainly speaks for itself. Not once did I see their passion for the work they were doing ever fade. So thanks. It's not just the public health team. Know that it made an enormous difference to our situation today. All of the teams within the department stepped up and were involved in the response, putting aside their regular work and literally diving into case management, calling, and the management of COVID. So thank you again to each and every one of them. But to the residents of this province, I think it's also important to say a thank you too. Because of your commitment to fighting this virus, we have landed here today. You stepped up, you abided by public health guidelines, and we lead the country, and I would perhaps argue even the world, in terms of our vaccination rates. They are second to none. I also want to say thank you to our interpreters who have accompanied us on this journey. Sabrina, Heather, Sheila, Danica, and Miles. They helped us ensure that our message reached everybody. And indeed, I would say they set the standard for other COVID briefings across Canada. Lastly, I'd like to thank the media. I have done before, but again, it's only appropriate to round out this way for keeping the people of this province informed about COVID-19. And they were instrumental in keeping everybody apprised of the changes that sometimes came fast and furious, but allowed us to be nimble and end up where we are today. So with that, I'm going to hand it over to Dr. Fitzgerald for her update. Dr. Fitzgerald.
Thank you, Minister. Good afternoon, everyone, and thanks for joining us on what I hope will be our last COVID briefing. So 2 years ago this week, many of us were going about our regular activities. The east coast of the province had not long dug out from Snowmageddon. Winter getaways and St. Patrick's Day festivities were being planned. In the background, the word coronavirus was starting to make its way into daily conversations, and at that time, we really didn't know how this virus was about to change our lives. Friday marks the 2-year anniversary for our first COVID briefing. Since then, we have lived with uncertainty, worry, sadness, but we also saw the best in humanity. We adapted to the new reality, we supported one another, even if we couldn't be together in person, and we celebrated our essential workers. On Monday at 12:01 a.m., we will close one chapter and begin a new one. As the Minister said, the public health emergency will be lifted and all special measures orders will come to an end, and we will then embark on a new normal. Many thought when this day came that COVID would be over. Unfortunately, COVID is not over. We continue to see circulation of the virus It has been a tricky and persistent nemesis from the beginning. On many occasions, we thought we were almost out of the woods and COVID threw us another curveball. And here we are 2 years and several variants later. COVID is still with us in the form of a milder illness. Our active case count is now 3,675, and our total case count to date is 28,103. We know that the actual number of people in our province that have had COVID is much higher, likely about 15 to 20% of our population. The combination of a milder variant, a high vaccination rate, and growing immunity through natural infection is significantly reducing the impact of COVID-19. Despite the fact we have community spread, our hospitalization rate remains stable and manageable, and we currently have 20 people hospitalized due to COVID-19 severity. This tells us that the time is right to take the next step in reopening. As I indicated last week, some public health measures will stay with us. Masking will continue to be strongly recommended, at least until mid-April. When we start to see milder weather and activities moving outdoors, we expect this COVID wave to subside. Good hygiene will always be important, so ensuring we have clean hands and covering our coughs and sneezes helps keep everyone healthy. It is also important to stay home if you are sick. Self-isolation and testing for cases and contacts are not under special measures orders and will still be in effect after March 14th. So please refer to our website for the latest guidance if you test positive for COVID or are a contact of a case. COVID-19 vaccines will continue to be available. I strongly encourage everyone who is eligible to get vaccinated, whether it's a primary series or booster. Even if you have been infected with COVID, you should still get vaccinated or boosted. Once your symptoms have resolved and your isolation is finished, you can receive the vaccine. We will continue to look to guidance from the National Advisory Committee on Immunization with regard to the future use of COVID-19 vaccines. We may need to adapt again in the fall as cold weather approaches and as we start to move our activities indoors. We know that respiratory viruses start to circulate more, and COVID will more than likely be among them. We don't know just what that will look like or how well our immunity will hold up over time, and it may mean new approaches to managing the virus and pivoting once again. We know that for a very small segment of the population, COVID-19 will be a severe illness, and most of those people will go on to recover. However, it is statistically inevitable that with thousands of cases, we will lose some people to COVID-19. We see the same pattern annually with influenza, which can be a very serious respiratory illness for some people. Sadly, we are reporting 4 new deaths to COVID-19 today. We send our condolences to the loved ones of these individuals. I know it can be hard to reconcile reopening when there are individuals succumbing to a COVID infection. Make no mistake, every life lost is a tragedy, no matter their age, vaccination status, or health status. Everyone has it in their power to protect themselves by masking, keeping your contacts low, distancing from others, and avoiding high-risk situations such as crowded gatherings. When we get in our car, we put on our seatbelt to protect ourselves, and we follow the rules of the road to ensure everyone stays as safe as possible. No matter how much care we take while driving, accidents still happen. But we continue to drive each day knowing that risk is there, and life is full of risks, but we have to go on living. And while scheduled COVID-19 briefings are coming to an end, we will continue to report COVID trends in the province. We are developing a new interactive dashboard which will go live on Monday. Most of the data will be updated Monday, Wednesday, and Friday, with the exception of age and vaccination status of those who have died due to COVID-19. As these are such small numbers, we only update in groups of 10 to protect privacy. This dashboard will replace the department's regular COVID news releases and social media posts, and it will look different than our current COVID data hub, with more condensed information. With so many people now availing of rapid tests at home, PCR testing is not reflecting the full scope of testing. The new dashboard will therefore not report the number of PCR tests administered. Likewise, if you have tested positive on a rapid test at home, you will not see that number in a public report. Self-reporting positive rapid test also does not provide you with any official documentation of your COVID infection. The self-reports are a tool for public health surveillance to monitor COVID-19 trends. In time, we will start to adjust our recommendations on testing and isolation, focusing on those who are at highest risk of severe illness. Going forward, all changes to public health guidance will be communicated through news releases, social media, and our COVID-19 website. We ask that you stay tuned to the latest information so that you can make the best decisions for yourself and your family. There are so many people who helped our province get through the worst of COVID-19. Too many to thank here today, but I do want to acknowledge our amazing staff in the regional health authorities who have been on the front lines of our response to COVID-19. And I also want to thank our core public health team in the department. This remarkable group has worked many long, hard hours, making very difficult decisions. You may not know their faces as you do mine, but the contribution they have made to this province is truly immeasurable. Last but not least, I want to thank the people of the province. Public health lives in the community. It lives in the day-to-day decisions and actions that each of us make. You made the choice to listen, follow the guidance, and get vaccinated. You made us the most highly vaccinated population in Canada and perhaps the world. You did what you needed to do to protect one another. And that's what we are best known for, and I'm so proud to call this place home. We may not agree on all things all the time, but it is certainly fair to say that we care deeply for this province and for one another. That is the beacon we must follow moving forward. I know that whatever comes our way, we can rely on the people of our province to step up and do what's right. And from the bottom of my heart, I thank you. And for the last time, I hope, hold fast, Newfoundland and Labrador. Thank you.
Thanks, Dr. Fitzgerald. Before I hand it over to Nancy, I just wanted to provide a bit of a clarity about the vaccine mandate. While the Vax Pass will end on March the 14th with the easing of restrictions, the COVID-19 vaccine regulations remain in place till June the 1st. These are the regulations that apply to employees and service providers of certain businesses, facilities, and organizations. While the Vax Pass and Vax Verify will continue to be available after the 14th in their current state, they will not be updated, either with regard to new vaccines or software. I also want to reiterate that masking policy will remain in place in all healthcare facilities, as we're still dealing with an infectious disease that's prevalent in our communities. It's important to note that while we've changed the number of visitors permitted in long-term care or personal care homes, these places may still have restrictions in addition in place if there is a COVID outbreak in that facility or unit itself. At any point in time, as with other infectious diseases, the visitation policy can be altered and will be if needed, as the focus is on protecting what are essentially some of our most vulnerable citizens. So with that, thank you very much, and I will turn it over to Nancy for moderating the question and answers.
Thank you, Minister. We have 5 reporters joining the news conference this afternoon. The first round of the question and answer session will give each reporter the opportunity to ask one question and one follow-up. Following this, there will be a final round where each of the reporters will have the opportunity to ask one final question. Our first questions today are from Peter Cowan of the CBC. Please go ahead and make your way to the mic.
Question for both Dr. Fitzgerald and Minister Haggie. Hospitalizations is going to continue to be the number that I know that you're going to be looking at. What level would it need to reach for you to say we need to bring in measures again? And from a capacity point of view with the system, what sort of level does the system able to take if we started to see a spike in hospitalizations?
So, you know, we certainly have been looking at that with modeling, and we think, you know, based on what we see, based on the case rates, we think that at the moment where we will end up will be manageable. Certainly, you know, it's difficult to put a number on it because sometimes it depends on the level of care that's needed as well, but I think our system certainly would be able to manage between 40 and 60 cases, and we would be looking at a few things other than just the actual number of hospitalizations and things like the rate of rise in cases and things like that. We would certainly be watching closely, so at the moment it appears that certainly that capacity would not be overwhelmed.
From my point of view, just to complement what Dr. Fitzgerald said, the other piece of that is the level of care required, as Dr. Fitzgerald referenced. Our ICU capacity is in actual fact proportionately greater at the moment than our inpatient capacity. The vacancy on ICU is around 80%, whereas the occupancy in ICU is around 80%, whereas the occupancy overall across the 13 Category A sites, for example, is nearer 99%. The other piece is around staffing. We have, as of today, 867 staff out. Of those, 515 actually have COVID, 234 are symptomatic, and the remainder are in a mix of work isolation and home isolation. So that's another statistic that we will keep an eye on, and the number of staff isolating has fallen. Obviously, that increases our capacity.
And I want to ask about the vaccine passport and the requirement for employees to continue to be vaccinated. If we're dropping all of the other restrictions as of Monday, why are we still requiring those employees to continue to be vaccinated up until June 1st?
That is an issue that is under review. These people are workers in areas where they would have significant contact with the public or vulnerable persons, and it was felt that as we let go of most of the restrictions, this, as it was done through regulation and doesn't involve a public health state of emergency, we would review at a later date, and certainly probably beyond Easter. But it's set to expire automatically at the moment on the 1st of June.
Our next questions are from Peter Jackson of the Telegram. Please go ahead and make your way to the mic.
Good afternoon. Peter asked one of my questions, but I also wanted to ask about vulnerable people. We're hearing a lot now, of course, from people who feel they're being abandoned after 2 months of being under protective care by restrictions. They feel that now they're being thrown to the wolves to some extent. What is your message to people who are immunocompromised, who are older, who fear that the world is going to be much more dangerous place to them?
So I think certainly, first of all, I'd like to say that I understand where that concern is coming from, and I think obviously if you are in a situation where you're immune compromised, that can be quite, I think that's quite a scary place to be in general, and COVID doesn't make that any easier. We do know, though, that we have ways to protect ourselves. As we said, there's masking and making sure we wash our hands well and keeping our distance, and all of those things are important, really, in that regard. The difficulty really comes with, our decisions have to be at a population level, and so we have to look at the population in general, and certainly the hardships that come with some of these measures being in place. That's not without consequence as well. So, it's time for us, with a milder variant, with a highly vaccinated population, to move on to this next stage. But all of those measures that have helped us for the last 2 years will still help in this situation.
Thank you. And the other question I had was about rapid access or rapid antigen tests. There's some suggestion by people who are vulnerable that perhaps these tests would be better used, not necessarily by them, but perhaps by people who are going to visit them or going to be in their presence, that they would have much more use for knowing whether there's a possible exposure around them.
So intuitively, I guess that does seem to make sense. What we know about antigen tests, and especially antigen tests in Omicron, is that that they're not quite as good at picking up infection, that it takes a little bit longer because Omicron is infectious at a much lower, or it can spread at a lower what we call viral load, so the amount of virus in your system can be lower. It may not actually be picked up by the test at the time that you're infectious. So you know, even it might pick up some, but it won't pick up all. There's that worry about a false sense of security, about a false negative test, so to speak. What we know is that these tests perform best really in symptomatic people when they're done like 2 tests in a row, as we have with some of our symptomatic programs, you know, 72 hours apart, like we do in schools and daycare. And when we use them in asymptomatic people, and we do use them for you know, in vulnerable settings, so people who work in long-term care and personal care homes and that sort of thing, they are getting regular testing done with rapid antigen tests, but it's serial testing, so it's every couple of days. It's 3 times a week. So, and that gives us better answers, but a one-off test doesn't necessarily tell us what we need to know.
Our next questions are from Richard Duggan with VOCM. Richard, please go ahead.
Thank you. My question is for Minister Haggie. You mentioned that the plan is to repeal the public health emergency effective as of 12:01 Monday morning. Can you just explain what exactly that means in terms of public health and what they're able to do?
What it means is that the authority for issuing special measures orders by the Chief Medical Officer of Health is rescinded in the sense of population-based orders like vaccine, about isolation and testing and visitors, those kind of things that we've become used to and we've discussed in this forum. The Chief Medical Officer of Health, and indeed the Regional Medical Officers of Health, still have authority under the Public Health and Health Promotion Act to issue individual specific requirements related to infectious diseases. But this kind of blanket approach is lifted, and we go back to using the more traditional tools of public health from a legislative framework. What we are looking to do is to allow people to transition to a newer normal.
And with COVID now circulating so widely in our communities, I'm wondering what the future is of the wastewater testing that we've been doing. Is that something that the province will be continuing with?
Yes, so we are continuing with wastewater testing and certainly looking at how we will use that as part of our surveillance going forward. You know, it's you know, one of the silver linings, I guess, of COVID is that we've learned to use this tool, and hopefully we'll see it expanded to look at other types of surveillance and to use in other areas of health. So yeah, you know, right now we're looking at how we best use wastewater surveillance, but we are definitely planning on continuing.
Our next questions are from Ben Cleary with NTV. Please go ahead.
Thank you. My first question is for Dr. Fitzgerald, and that's the province's Teachers Association came out yesterday and said they're concerned about COVID spread in the classroom after March 14th, even with masking happening. So I was wondering if you could address those concerns.
So certainly, you know, we know that spread in the classroom. I mean, it certainly can and has happened. And you know, with masking still in place and other measures still in place, then I think, you know, we would not expect the rate of spread within a classroom to increase significantly after March 14th. As I said, our case and contact management guidelines would still be in place, so we would still expect that people would go to our website if they've tested positive to find out what they have to do, and that household contacts would, you know, would follow the guidelines appropriately, as would non-household contacts. So, you know, all of that is still in place, so not anticipating a big difference in spread through classrooms.
Thank you. And my next question is for Minister Haggie, and it's kind of a follow-up to Richard's question. But what would it take? Where does the goalpost kind of stand now for the province to re-enter a public health emergency?
In broad brush terms, it would be a situation where the severity of illness was such that our routine, regular healthcare system looked to be in jeopardy of being able to sustain the workload on it. What exactly those metrics are, Dr. Fitzgerald has mentioned a couple, and we've talked about hospitalizations, and we've talked about ICU admissions. What the trends are, we continue to monitor, and we also have advice from Public Health and our science table, who will still be reporting regularly to us over the course of the next little while. So it's difficult to predict in advance, and I've said this from 2020 onwards. And all of this, of course, is against a background of a possible, another variant. We thought we'd done with the wild strain, and then we thought we'd done with the UK strain, and we've found ourselves with 4 or 5 waves in total. So it's a little difficult to be dogmatic, but I think awareness is the key from public health's point of view.
Thank you.
Our next questions are from Roger Bill with the Shoreline News. Please go ahead.
Dr. Fitzgerald, I'd like to follow up on a question that Peter Jackson asked about immunocompromised people and older people who are at greater risk. I listened to an interview on CBC Radio last week with a woman from Puchco named Katie Pittman, who is wondering how she's going to navigate everyday life in the new normal. Well, she can make decisions like not visiting her grandson and not going to the coffee shop and not going to movies. She said, I still have to go to the grocery. What are the pros and cons of leaving some restrictions on things that people have to do essentially for another couple of weeks as you transition to this new normal?
So I think, that we have to move forward at some point, and we've looked at what our vaccination rate is, and we've looked at the disease severity itself, and so we've made decisions based on that information, and I think as difficult as it is for people to navigate, that it still is something that we have to do, and so it is. I can appreciate that people do have this trepidation and fear, but COVID is not going to be here in the numbers that it is right now forever, and we will see that go down. And all of those same measures that we've used over and over again, wearing a mask and keeping your distance, washing your hands well, if we stay home when we're sick, all of those things will continue to protect not just yourself, but other people as well.
I understand that, but I think what people who are at risk, at greater risk, feel like why do we have to do that? Why do we have to remove the restrictions for everyday essential needs like going to the grocery? I understand we need to get back to normal life, but all at once, everything? I think that's the question they're asking.
So it hasn't been all at once, but the legislation is quite clear that we can only have a public health emergency in certain circumstances, and that the measures that we put in have to be the least restrictive measures that are possible. And if you can do what needs to be done at a population level without a public health emergency and special measures orders, then that's what the Chief Medical Officer of Health is obliged to do under the legislation.
Thank you.
I will now go back through each reporter to see if you have one final question. Peter Cowan of the CBC, do you have a final question?
I do, and it's one for Dr. Fitzgerald. I noticed you got a little emotional there at the end of your prepared remarks. What's sort of going through your mind, and why is this an emotional moment for you?
So I think it's been a long, hard 2 years, and I think everybody is sort of getting to a point where it's been, everybody is ready to kind of move on, and I think it's just thinking about what we've accomplished and what we've done as a province. It makes me very proud. So I tend to be an emotional person, and that's that's the way I react. There's really nothing much more to it than that.
Peter Jackson of the Telegram, do you have a final question?
Yes, I do. We're certainly not the first jurisdiction in Canada or even the world who's decided to just drop the whole protective system and try to go without it. Is there anything you've learned or seen from other jurisdictions, such as the United Kingdom or even a couple of other provinces, that have already dropped them, that would be cause for either concern or optimism?
So I think we have seen that some provinces have lifted measures, and they are seeing a reduction in case counts. It's difficult to compare us to other provinces because we're not exactly the same. We don't have the same vaccination rates. We don't have the same natural immunity. So we have to think about that. I think we've always watched things closely, and certainly, the analytics team, the modeling team, they've watched things closely. So we'll continue to do that. But at the moment, we certainly haven't seen anything that would make us change tack.
Richard Duggan with the OCM, do you have a final question?
I do. It was March 14th of 2020 that we reported our first case of COVID, and now on Monday, March 14th, 2 years later, we're scrapping a lot of the, the mandatory masking, et cetera. Dr. Fitzgerald, I was just wondering, how does it feel for you? Is this kind of like a full circle moment to be able to lift these 2 years to the day?
Actually, I didn't even realize the connection there until well after we had made the decision. So, but it is quite remarkable. I mean, we certainly felt that, this spring would be the time that we had to think about moving this way. And, it has been quite a journey and quite interesting that it is 2 years to the day, but not 2 years to the day from the first special measures order or when the public health emergency was declared, but from our first case.
Ben Cleary with NTV, do you have a final question?
Yes, I do. Thank you. It has to do with the NL VaxPass and the COVID Alert app, the apps we have because of COVID. Should people delete those on March 14th, or should they keep them on their phone just in case?
Why would you delete them? I mean, if you've got them working, and I don't know yet what the federal requirements are. You don't know what international requirements are for travel, so that might be a factor. If you're running out of storage, then by all means get rid of it.
Thank you.
Roger Bill with the Shoreline News, do you have a final question?
Yes, I do. Since I seem to be the last reporter in the last media briefing of the emergency period, on behalf of the journalists who've been doing this, let me say thank you for Dr. Fitzgerald and Dr. Haggie for being available, and thanks Susan Hollett and Jillian Hood who deal with us getting these things organized. Not easy for them. Excuse me. A last question. We keep hearing that the new normal is going to, COVID's going to be like an influenza. An influenza-like statistic is what we should expect. I went back and looked at the influenza data for the last 5 years in the province, and we averaged 20 influenza deaths a year. In the last 2 months, we've already had 47 COVID deaths. And we're on track to have, if that holds, 200 plus COVID deaths in a year, 10 times the influenza statistic. Can we say that 200 deaths is an influenza-like statistic?
So I think we need to take that 200 number we need to look at that very carefully because, we don't anticipate we're going to have this level of COVID circulating in the community for the rest of the year, which would, have to be happening to have the same number of deaths. And the thing you have to remember about influenza is that is of confirmed reported cases. So those are only people who have influenza, who have gotten tested for influenza and have been admitted to hospital. So it doesn't really take into account people who get influenza and don't get admitted to hospital. And there are lots of those. So, a lot of people who live in long-term care and personal care homes do not end up going to hospital if they get severely ill from influenza. The decision is made that they stay in the home. And so, I've had situations throughout my career when I've worked in long-term care for many years where I've had 20 people die from influenza in a month in one home. So, these are surveillance data that we are using here. They're not really, they have to be interpreted with caution and with the knowledge of, the knowledge that we have in public health that is looking at the whole picture. So you have to be very cautious when you're making those broad statements.
Thank you.
Thank you, everyone. Minister, do you have any final comments?
Yes, it's hard to figure out exactly how to round out, except I think to say we started this and it's been described as a marathon with hurdles. I think that's still accurate. We're not yet to 12:01 on the 14th, although the tape may be in sight. But again, I'd like to thank everybody. And I'll steal Dr. Fitzgerald's famous phrase, hold fast and take care.
Thank you, Minister. Thank you, everyone, for joining us today. Please stay safe and enjoy the rest of your day.